All right, go ahead.
Medicare and Medicaid. Um, this is the history of Medicare. Before Medicare, only 65% of those over 65 had health insurance. Now, originally, Medicare was a program providing medical care for families of individuals serving in the military. And in 1961, President Eisenhower held the first White House Conference on Aging. And then following that, under the endorsement of President Johnson's Great Society in 1965, it was originally to be funded through payroll deductions from citizens to become part of a trust fund that would earn interest over time and be available at 65. On the history of Medicaid, it was federally mandated in 1965, but the majority of its funding comes from the states. It is state administered for those under the poverty level. Now, not all states are required to participate, and the Patient Protection and Affordable Care Act of 2010 expanded Medicaid eligibility in 2014. And that's all I know.
All right, so now we're going to get in a little bit to the components of Medicare. If we go down to the next slide, Medicare is broken down into parts A, B, C, and D. So the coverage that you get with Medicare is going to depend on three things. There's three factors to it. So there's federal and state laws, national coverage decisions that's made by Medicare just on what's covered, and then there's also going to be local decisions made by companies in each state that process the Medicare claims. And so that's going to determine what's going to be coverable by your Medicare service. So let's go now into Part A, and we'll talk about what that covers. So Part A of Medicare is going to be hospital insurance. So the key thing here is it's going to cover necessary hospital visits. So it has to be deemed necessary, and there's a lot more that goes into that. So you'll have necessary hospital visits included in this, as well as skilled nursing facilities, home health, as long as you need help with more than just like janitorial work. And then hospice care is also covered in Part A of your Medicare. So Part B is kind of the more general medical insurance. So here we've got different bullet points of what it covers. So there's clinical research, ambulatory service, medical equipment, mental health, second opinions for surgeries, outpatient. So that's basically going to cover most of your needs, is going to be in Part B outside of hospital stuff. Part C is kind of different from the others because it's not a separate benefit. From what I've been able to research about Part C, this is what allows us to have private insurance companies giving people benefits. So it's associated a lot with Medicare Advantage plans. So you got HMOs, health maintenance organizations, preferred provider organizations, private fee-for-service plans, as well as medical savings account plans. So it's not the main thing to remember for that is it's not a separate service or coverage, but it's kind of an addition to it. So then Part D is just prescription drugs, and so depending on what plan you have with Part D, you have a formulary, which is basically a list of drugs that are accepted in your plan, and then each drug has a different tier. So higher tier drugs are going to have a higher copayment. Depending on what insurance you already have, they could be called what's credible prescription drug coverage, meaning your insurance may give you better drug coverage than Medicare would, and so that's just one of the important reasons to be educated about it, is to make sure that you're getting the best coverage possible based on your circumstances.
Okay, that's me, and Medicare and Medicaid funding. This is an illustration of how the two programs work together to complete the federal healthcare system. Each has its own components, but people can have both if needed. Okay. All right. Medicaid funding. The Medicaid program is jointly funded by the federal government and states. The federal government pays states for a specified percentage of program expenditures called the federal medical assistance percentage. FMAP varies by state based on criteria such as per capita income. The regular average state is 57%, but ranges from 50% in wealthier states up to 75% in states with lower per capita incomes. The maximum regular FMAP is 82%. I am so sorry. People are at the door right now. Out-of-pocket costs may include payments, co-insurance, deductibles, and other similar charges. Maximum out-of-pocket costs are limited, but states can impose higher charges for targeted groups of somewhat higher income people. All right. Okay. Medicare funding. Medicare is funded through 2 trust funds held by the. Sorry, I'm talking about it. Yes, go call Papa, please. Go call Papa. I'm so sorry. Medicare, I'm going back again. Medicare funding. Medicare is funded through 2 trust funds held by the U.S. Treasury, Hospital Insurance Trust Fund, Supplementary Medical Insurance Trust Fund. Medicare is funded by the Social Security Administration, and I just lost my. Okay, it's funded by Social Security Administration, which means it's funded by the taxpayers. That's what I got. Oh, oh, okay. Sorry. Hospital Insurance Trust Fund, funded by payroll taxes paid by most employees, employers, and people who are self-employed. Other sources like income taxes paid on Social Security benefits, interest earned on the trust fund investments, and Medicare Part A premiums from people who aren't eligible for premium-free Part A. I have some notes here, and I can't. Okay, we all pay 1.45% of our earnings into FICA, Federal Insurance Contribution Act, which go toward Medicare. I have some notes right here. I can't see them. You are self-employed. You must pay, if you are self-employed, you must pay the entire 2.9%. I'm so sorry. My house right now is so busy. I don't even know why. Yeah, that's what I got. That was slide 14. And now, I think now it's Matt's turn.
Are we on slide 16 now?
Yeah, slide 16 is you.
Perfect. So we see here that the second major part, or the major trust fund for Medicare, is called the Supplementary Medical Insurance, or SMI Trust Fund. And the money for this trust fund is actually comes mainly from the premiums that people pay for Medicare Part B or Part D insurance. And it also is funded through interest earned on trust fund investments. And the important thing to remember too is that this funding is always authorized by Congress. Okay. This trust fund, the funds for this are usually used or allocated to pay for Part B and Part D benefits. which, as Jonathan explained, just goes towards your medical expenses, and then Part D specifically dealing with your prescription medication. And then it also goes towards the administrative costs for running Medicare. As it shows in the slide, important things like combating fraud and abuse of the system. So here's just a general graph that shows kind of how the funds for Medicare are broken down and allocated in the Medicare system. As you can see, the majority of the funds are used for hospital expenses. And then after that, you have the private health care plans as part of Part C Medicare insurance. Okay. One thing really interesting that we found is that if left unchecked, if new government legislation doesn't come out, then the current benefits available to Medicare recipients will only last until 2030, excuse me. After that, the benefits will have to be reduced in order to be sustained by the funds that are available. Something that I didn't know before is that the Affordable Care Act, or Obamacare, actually extended the life of Medicare by about 4 years. So we can see if the government is able to make more legislation concerning this issue, then it could be extended farther. But that's going to be tough to do because healthcare costs are rising, and then also the number of people entering into Medicare is also rising as well. As you can see from this political cartoon, the baby boomers are in the Medicare age now, and so because of that and rising healthcare costs, Medicare spending per beneficiary is expected to rise about 40% in the next decade. And those are sources.
Great, guys. Thank you so much for that presentation. You know, I learned a lot from you guys. I learn something new every day, right? What I'm going to go ahead and do is I'm going to go through and ask each of you some questions. Same questions I ask everybody, but I'll go ahead and ask and then work our way across. So, Matt, I'll start with you. You know, you mentioned a little bit about some things that you didn't know, but you know, what was something else that you may have learned, or something that surprised you about CMS that you didn't know before, besides the it got extended by 4 years from November?
Right. Something I was surprised by was how soon it was going to funds to provide for 100% of the benefits of beneficiaries. I was surprised by how soon those funds were going to run out. So we're not, our Medicare fund isn't going to be 100% bankrupt by 2030, but the benefits that are available right now to our senior citizens will be reduced after that time. And I guess in my mind, I always thought that it was, you know, in like 60 years or something when we were going to run out of that money and have to do something different. But that's probably the most shocking thing that I learned.
All right, Jennifer.
Yes.
Same question.
What did I learn that I didn't know?
Yeah, or what surprised you the most about CMS?
Well, I don't know. I did learn a lot. I work with the elderly, so this really interests me about the Medicare and the different parts of Medicare, the different insurances, because I deal with that a lot, doing referrals and stuff for them.
Mm-hmm.
So it was a lot of information that I think that I'll be able to use.
Great to hear. All right, Jonathan.
Well, I'd say probably the thing that was most surprising, most impressive to me is just the amount of money that goes into these programs, just the hundreds of billions of dollars every year that we put into these. It's pretty amazing, pretty daunting, the sort of numbers. I spent some time reading the actuarial report for for Medicare from last year. Just the amount of money that we use on that every year is pretty incredible, and to think that it still only helps a small part of the population. So it kind of reminded me of how expensive healthcare is and how limited it is, even still with what we're able to do, even by spending so much money.
Right. Great, thank you. All right, let me come here. All right, Fatima, same question.
Okay. Well, the thing that I found the most interesting was the amount of the money that's paid through the Social Security system. And another interesting thing I found is that the Medicaid is set up different in every state because some states pay more than others for the Medicaid system. I thought that was interesting. I thought it was the same way.
Yeah, definitely. Medicaid is a state-run program, and then when we saw with the Medicaid expansion, that states at first that all states were going to be required to expand Medicaid to the I can't remember the poverty level that it was, but at the time they were going to be required to do that, and then the Supreme Court came back and decided that wasn't constitutional, and that states could choose to expand Medicaid if they wanted. And so you saw some states expand Medicaid while others chose not to expand that level of people that they covered based on their politics. But yeah, CMS is a very important part of healthcare, the healthcare industry right now. As we learned, I believe it was in the first lesson that government-funded healthcare is the highest funded healthcare, or the highest payer in the industry. So there's a lot, as Jonathan said, there's lots of money flowing from Medicare, Medicaid into healthcare, and so it's really important to cover several millions of lives every year.
Yeah.
So, all right, I'm going to stop the broadcast.
Okay.